Okay, hi, Assalamualaikum and very good morning. My name is Nurbatina Baruta Zakaria. My mental number is 263326. Okay, I'm going to start my part, which is introduction part. Okay, the success of Malaysian Ministry of Health in controlling the spread of COVID-19 have already become 5 best countries in the world. MOH achievement are health enables school students to go back to school and public and private university students to go back to the campus. Besides that, they also managed to get 0 case daily for a long time ago. Okay, this is all thanks to Dr. Noor Hisham because he gave a firm decision and he also gave opinions to the government about how to maintain the safety. Okay, now we're going to continue to 2.0, which is organizational background. Okay, MOH is an innovative, people-centered, and medical excellence organization. Okay, one of the Ministry of Health rolled out to improving the health of Malaysians through efficient and effective policy, especially during COVID-19. Okay, the current health minister is Datuk Sri Dr. Adham Baba, assisted by 2 deputies, Datuk Dr. Nur Azmi Ghazali and Datuk Aaron Agbo Dagang. Okay, Datuk Dr. Noor Hisham Abdullah is our current Director General of Health in Malaysia. Okay, MOH has only one role of providing advice and informing the latest developments related to coronavirus outbreak COVID-19 to the government. Okay, MOH also provide guidance on hygiene practice, social distancing, and they tell us to follow SOP in order to help them prevent the COVID-19 spreading together.
Tan Sri Datuk Dr. Noor Hisham is a protagonist in our study who is always motivates public to progress and is also a figure who is gaining publicity among managers after demonstrating an excellent leadership skill in dealing with the COVID-19 crisis. He will always speak calmly about the latest details on the COVID-19 outbreak and what should public do in order to fight it. I think the position as the manager's Director General of Health seems to be made for him because of his reassuring manner and attitudes on check data from reliable sources to make informed decisions have won him praises among managers for demonstrating that the disease control can be done effectively.
Leadership in organization is very important to gain understanding and trust from the public. They need to have leaders who are considerate and wise in solving big problems. The Ministry of Health presents emphasis on empowering physical and other frontline workers in the term of decision-making. Competency also explicitly highlight the need for collaborative leadership that covers wide leadership practice by physicians and other frontline workers and their manager decide just for that purpose. The greatest way to establish collective leadership is to focus on the group as a whole rather than on individual leader. The most effective board leadership of council assess the vision and value of their organization through what they follow, monitor, reprimand, or reward.
Hi, I'm Iswari Anak Perempuan Suresh Kumar with matrix number of 272799. I'm here to present about decision-making process, which is viewed as the intellectual cycle, bringing about the choice of a conviction or a game plan among a few potential elective choices. It is also defined as a thinking cycle dependent on suspicions of qualities, inclinations, and convictions of the choice made. It is also characterized as a way to settling on decisions by recognizing a choice, gathering data, and surveying elective goals. It helps to make more purposeful, smart choices by getting sorted out significant data and characterizing choices. As per the medical service framework, there are 6 key jobs that have been distinguished, and clinical choices can be arranged into 3 classes. As per examining the fundamental states of the managerial cycle in medical care, and it helps in creating devices that medical service associations can use to survey their own dynamic cycles and consequently plan arrangements. We know that our government is taking and coming up with new rules such as wearing masks is now compulsory. Curfews are implemented and they're getting tight. They are increasing the workforce to attend the patients, with the number of patients getting more every day. We know that the pandemic cannot be stopped, but we can assure that we can help them to prevent the spreading of COVID-19. Thank you.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Firdaus Muhammad Siddiq and my metric number is 258169. So I will conclude all of the presentation that all of my friends has discussed. All in all, in every crisis or every problem, there always be a person or a group of people who need to take an initiative or take part to solve the issue and to find the solution of the problem. Based on the circumstances, someone who can solve it or someone who can direct and lead people to help him or her to solve the problem is considered as a leader. Being a leader also requires a decision-making process when needed. Then, the consideration that leaders need to be considered should be based on public interest, and the objective is to solve the problem with the resource that the organization, country, or the company has. At the end, someone will be considered as a protagonist if she or he becomes the main figure or one of the most prominent figures in a real situation. In this report that has already been discussed, the issue is about the pandemic COVID-19 that has been spread in all Malaysia. And Tan Sri Dato Dr. Nur Hisham bin Abdullah is the protagonist on the issue, because he is one of the figures that has an important role in solving the issue. He also succeeded in decreasing the number of cases of COVID-19 from time to time since March 2020. Okay, that's it from our group. Thank you for your time and attention. Wassalamualaikum warahmatullahi wabarakatuh.